If you feel pain in your legs whenever you exert yourself, like when you're walking, and then it goes away when you rest, you may have peripheral arterial disease, or PAD. Joining me to talk about PAD is Dr. Rocco Ciocca, Director of Vascular Surgery at MetroHealth Medical Center. So, welcome to the show.
Thank you, Lori.
All right, so what causes PAD and how many people are actually suffering from this?
Yeah. It's caused by atherosclerotic disease, which is otherwise known as hardening of the arteries. And what that is the development of plaque or narrowing of the arteries, secondary to buildup of fatty tissue, calcium, and cholesterol. And it leads to narrowing and sometimes actually complete blockage of the arteries.
Ooh, so how do you know? What are the symptoms?
Well, the symptoms, as you say, can be quite subtle at times. But as the disease advances, particularly for the lower extremity, which is very frequently involved, people get symptoms which we call intermittent claudication, which means pain when you walk. Very often it involves the calves, sometimes the thighs, sometimes even the buttocks. And it's secondary to the tissues, so the muscles not getting enough oxygen because the blood flow is not adequate.
So they hurt.
They hurt.
So lots of people suffer from this?
Yeah, unfortunately they do. It's estimated that upwards of 8 million people in the United States alone have PAD.
Wow.
And upwards of 12 to almost 20% of adults over 60 have some component of PAD, so it's a quite prevalent problem.
So what are the risk factors involved?
Yeah, the good news is that many of the risk factors can be controlled, and the risk factors include, first and foremost, smoking. So any and all people who smoke have to stop smoking, and it's one of my biggest concerns, particularly here in Cleveland, as I see a lot of people smoking. I see a lot of young people smoking.
Way too many.
And that, in addition to causing other problems like lung cancer, atherosclerotic disease, including coronary disease and peripheral vascular disease, is a major component of smoking. So smoking is a major risk factor.
Okay.
Unfortunately, a risk factor we can't control is age. So as we get older, our arteries do tend to harden, if you will. So that's not something we can control. Another major risk factor is diabetes, and that is very much associated with the development of hardening of the arteries and peripheral arterial disease. And again, that is something that in many instances can be controlled with proper diet and exercise. So
if you control some of these risk factors, you can prevent the disease from coming?
Well, very often. I mean, not in all instances, because there are a subset of patients who are prone to the development of peripheral arterial disease despite lack of risk factors. The other risk factors that we need to mention is high blood pressure or hypertension and high cholesterol.
So you control those. Those are really important.
So we really work to control all of those, and that's why it is important to have a good relationship with a primary care physician to identify these risk factors early and then mitigate them as early as possible.
Okay. Now, what if you don't address it? Does it get much worse?
It can. And in severe instances, it can really progress to the point where people develop what we call critical limb ischemia. And that can lead to pain even at rest, so pain that occurs even when you're not exercising, and that's obviously a very onerous sign.
A very serious sign,
and
yes.
In other advanced cases, we get patients who have wounds that don't heal, even sometimes to the point they get gangrene, which is a quite advanced stage. And obviously, we really prefer to address the issue prior to that stage.
So if anybody's seeing symptoms, get to the doctor, right?
They should. I mean, first of all, again, I can't emphasize enough, really work on those risk factors. And they're very, very common. I know it's not easy to quit smoking, but that's something that people do need to work on. You know, diet and exercise, we say it over and over again, but it's critical to eat a healthy diet and to exercise as much as possible. And if one does, then very often the manifestations of peripheral arterial disease can be avoided.
Well, that's good to know. So peripheral arterial disease is painful and affects up to 1 in 5 adults over the age of 60. But most importantly, it's preventable and reversible just by making these smart lifestyle changes that the doctor has talked about. My thanks to Dr. Ciocca for helping us to understand PAD just a little bit more.
Thank you very much.
To learn more, call MetroHealth at 216-778-7800 or visit their website www.metrohealth.org.